Hi everyone, my name is Christy. Thank you for joining us again for another series of the Kure Pain Management Q&A. I'm here with our provider, Dr. Cameron Saraf. Thank you for joining us.
Thank you.
And he's here to answer some questions that some of you had regarding our spinal cord stimulation. And the first question, of course, is will insurance cover the spinal cord stimulation?
Insurance generally does cover spinal cord stimulation. It's covered by Medicare, Medicaid, workers' compensation. You just have to meet the right requirements, have the right diagnosis, and if it's an appropriate therapy for you, then insurance will cover it.
Okay. And is SCS safe?
It's absolutely safe. There's hundreds of thousands of people around the world with spinal cord stimulators implanted. They're done every day all over the country. It's FDA approved, definitely safe.
Okay. And a lot of our patients, this question, I'm sure you get this often, will they be completely free of pain?
Every patient's different. Some patients are completely free of pain. Some people get a certain percentage of pain relief. We're happy with more than about 50% pain relief, and if that can improve a patient's lifestyle, then that's great.
Okay, and that leads me to the next question. A lot of our patients wanted to know about pain medications. Are they going to be able to be free of their pain medications completely?
Again, that's patient dependent. Most people can be free of pain medication. Some people still need it once in a while. But in terms of how much pain relief they get, it's something that has to be determined after they get the trial or the implant.
Okay. Next question, are they going to use the stimulation all day long, 24 hours a day?
That's also patient specific. Some people just use it while sitting at work or while doing some gardening or doing chores around the house. Some people do use it all the time.
Okay. Some patients wanted to know, will they be able to have MRIs, CAT scans, PET scans after they have the device implanted?
So once the device is implanted, some of the devices, depending on the manufacturer, are safe with imaging. CAT scans, PET scans, all of these things are safe. MRIs is the questionable one, and that's determined based on the device that's implanted. There's different companies that make these things, and depending on which one the physician puts in, that's a conversation that needs to be had with your doctor.
Okay. How big is the actual implant that's going in the patient?
It's about the size of a silver dollar. It's that big. It's implanted usually in the belly or in the buttock area, and it's really not really something that you would know is there unless you tell someone that it's there.
Okay. Can you briefly, this is a two-part question, does the patient actually control the stimulation themselves, and how does it work?
So every patient gets a remote control for the stimulator, and in the initial phase they start using the stimulator, getting used to it, and depending on the activity they're doing, whether they're walking, running, sitting still, they put on certain programs for that activity. And eventually patients learn to just program it the way they need it so that they don't need to fidget with it all the time.
Okay, another two-part. How long does the SCS last, and how long does the battery last?
So it lasts about 5 to 10 years depending on the product that's implanted. There are two different systems. There's a rechargeable system and there's a non-rechargeable system. The rechargeable one lasts about 10 years depending on usage, and the non-rechargeable usually lasts about 5 years. The difference is, again, just being able to recharge it or not, the convenience of just having a battery in there for 5 years and forgetting about it, or having to sit about once every week or once every other week to recharge it.
Okay, and how is it recharged?
The recharging is just using a little wireless device that you put on top of the implant. It's done about once a week. It takes a couple hours, so most people do it just sitting on the couch watching TV.
Oh, good. So it's done in their home environment. Mm-hmm. Okay, great. Another question that was very popular with our patients: will they set off the airport security?
Generally, no. They will not set off airport security, but they do get a little card that says that they have an implanted device if there's ever a question of with TSA or any other airport security.
Okay, great. Last question, also the most popular question I think that we received is, when will the patient be able to resume normal activities after the implant?
So once the implant is done, for the first 3 months or so, the patients have to have certain restrictions in terms of physical activity with bending, twisting, lifting, things like that, because the leads are still healing in place. After that, they can normally resume regular activity.
Okay, great. I think you've answered most of our questions. We appreciate you being here.
Perfect.
Thanks, everyone, and make sure to join us next time for our next series of Q&A at Kure Pain Management.